Tenor, experts in bladder weakness and incontinence for over 40 years.
After 4 pregnancies, Leonora Collins found that her body didn't quite function as it used to. Like many women, she discovered her bladder control was no longer as good as it used to be and sought help and advice on how to treat the problem.
After I had my kids, every time I jumped or coughed, I crossed my knees because I was so scared of relieving myself. And I didn't really speak about it to anybody because I just thought it was one of those things that you have when you've had kids, and it's just one of those things that you have to accept. I got a lot of infections and continuous infections where I was having 2 to 3 antibiotics a month, and I met with my gynecologist and he referred me to Dr. Fokoma.
Not all bladder weakness is the same. There's urge incontinence caused by an overactive bladder, overflow incontinence, which is an involuntary leakage, and the most common type, which is stress incontinence, when the pelvic floor muscles don't support the bladder correctly.
We often get asked if pregnancy actually caused incontinence. Basically, pregnancy is a definite contributing factor because when we are pregnant, we increase the intra-abdominal pressure, and the baby pushing down on the bladder increases the pressure on the bladder. So when you cough or sneeze, you actually leak urine, and that is what we call stress incontinence. If you are pregnant more than once, your chances of developing incontinence increase. If you develop incontinence while you are pregnant, it's a very good predictor that you're going to have incontinence later on in life.
One of the best interventions for preventing or managing stress incontinence is to exercise the pelvic floor muscles. A strong pelvic floor means better bladder support.
The important thing is to make sure that you exercise your pelvic floor and strengthen up those muscles. Prevent becoming too overweight because the increased pressure from being overweight is going to put extra pressure on your pelvic floor. If you suffer from something like an overactive bladder, there's certain things within your diet that are going to aggravate the symptoms. So when you drink milk, have anything with tea or coffee that has a lot of caffeine in it, chocolate, spicy foods, those are substances that irritate the bladder. So when you eat those or drink those, your bladder contracts more. And if your bladder is contracting, you're going to have a sense of urgency and you're going to have a bigger chance of needing to go to the toilet more frequently or even leaking.
Bladder control is an important skill which is learned at a young age. By changing some bladder control habits, one can prevent or manage bladder weakness.
As mothers, we often send our children to the toilet just in case. So we always saying, go to the toilet in case you need the loo. And we actually then teach our bladder that it's normal to go and empty with an empty bladder. So you should be going to the toilet approximately every 4 hours and emptying your bladder, not allowing your bladder to become too full because then you'll develop overflow incontinence. If you go to the toilet too frequently, you're at risk of developing an irritable or an overactive bladder. The other thing is women always tend to hover over the toilet. So if you're hovering over the toilet, you're actually contracting your pelvic floor. So it's making it more difficult for you to actually empty your bladder with a greater risk of then having urine that stays behind in the bladder.
If you do find that you are experiencing bladder problems, don't feel shy or embarrassed to consult your medical practitioner for assistance.
After being to the doctor, my life has completely changed. I'm healthier, and this seems to be a taboo subject, but I realize now that there are lots of women that suffer with the same problem, and there's help out there.
Ladies, we've got a tenor giveaway competition. To enter, simply SMS Tenor Lady to 33728. Rates and T's and C's apply.
Tenor, experts in bladder weakness and incontinence for over 40 years.